Hey everyone, I'm here with Sofia Dominguez.
So Valadez.
And Angel Hernandez.
Did you guys hear about the professional boxer Tyson Fury tested positive for the use of steroid nandrolone, also referred to as decadoberlin, in 2017?
Yeah, so basically I heard that he claimed that he never took Deca, basically, and that I guess Deca is like a low-risk steroid, but it doesn't have like positive and negative side effects.
Yeah, and I think some of those side effects consist of like increase of body hair growth, red blood count, and the bone marrow.
Yeah, and it provides oxygen to our body, right?
Yeah, I think so, and a decrease in sexual desire for men, and development of tissue. Other common side effects include headache, fluid retention, stomach intention, irritation, diarrhea, abdominal pain, jaundice, menstrual abnormalities, and hypertension, infertility, and behavioral changes, hair loss, and breast development in men, liver damage, and heart disease.
So Deca usually stays in the body for around 14 days and 4 to 6 weeks, but you won't see like a noticeable difference like other steroids. But it's used commonly amongst bodybuilders and athletes to like enhance their performance.
Yeah, and they also use it in clinical settings. That's how low risk of the steroid is.
Deca is by far like the most popular steroid in the world. It helps treat muscle wasting, HIV/AIDS, anemic patients, and it helps with joint pain, and it quickens the recovery from an injury.
It also improves lean muscle mass and body mass. And I think we have a video demonstrating how this steroid affects people.
Yeah, I've just seen a video of the symptoms of an athlete who is taking a steroid created by a company named Upjohn in 1960 called Mybolerone. It's also known as check drops. By the way, even Mike Tyson made the list of people who have taken this anabolic steroid.
These effects include increased aggression, which is why most people choose to take this drug. But people who take check drops will also experience severe acne, a deepening voice, women will have lessened or ceased menstruation, and hair loss for men who have been predisposed to balding hair growth patterns.
Yikes. Study shows that the risk of taking this steroid is not worth a single boost of aggression at that moment. Mybolerone is one of the strongest anabolic substances ever made and might even be the most powerful androgen ever created. It is derived from another popular steroid, nandrolone, which ultimately leads it to be considered a C17 alpha alkylated anabolic steroid.
Yes, Upjohn claims Mybolerone to be 6 times stronger than testosterone and 3 times as potent as androgenic compounds. The actual purpose of Mybolerone is to disrupt the menstruation cycle in a female dog, which would prevent them from getting pregnant.
So who usually takes check drops?
Because of its most known popular side effect of increased aggression, some people who participate in aggressive sports, such as football players or fighters, take check drops.
The sale of Mybolerone is actually prohibited in sports due to its effects on the body and adrenaline. It takes about 30 minutes to start feeling its effects after consuming the oral anabolic androgen, and the boost of energy, aggression, and power lasts about 4 hours. When fighters take check drops, they actually take it in micrograms rather than milligrams because of its potency.
That's like the size of a microgram. It is barely visible to the human eye, what makes check drops so strong and dangerous.
Well, to start off, due to its intended use, women have a high risk of damaging their fertility because of its unique use in determining the ovulation cycle in female dogs. Users may also experience liver damage, gynecomastia, insomnia, hypertension, high blood pressure, water retention, estrogenic and androgenic effects, and hepatotoxicity. So we would recommend you to all be very precautious in the involvement of steroids.
If you have any more questions about any other drug enhancers or steroids, please be sure to do your own extensive research.
Consult your doctors, physicians, or other pro athletes before consuming anything.
Thank you for watching this week's podcast.